Yes. Mm.
Okay, so the first thing we look at is non-accidental trauma. Okay, non-accidental trauma. In short, we have NAT. We are saying it refers to physical injuries inflicted on a child that are that are deliberate and not consistent with the given history. Non-accidental trauma. So when you hear of this or when you say this, just look at how the word is. You know, accidents are unforeseen circumstances, they are not deliberate, right? So when we say non-accidental trauma, what we mean is that it's any physical injury that is being inflicted on a child deliberately, and they are not consistent with the history most of the times they give during hospitalization, okay, or during admission. And it's often seen in cases of child abuse, like I said before. So when you see this NAT, non-accidental trauma, it's mostly referring to most of the times cases of child abuse. Okay. All right. Sorry. Now, the next one to talk about patterns in non-accidental trauma. So how can we see them? Okay, how can we see them when they come to the hospital? When a caregiver or a parent brings a child to the hospital and you want to know whether an abuse or you want to suspect an abuse, how do you know? So when you look at the left-hand side here on the screen, we are saying injury patterns in non-accidental trauma. For these cases, this is what you see. You can have long bone fractures in the humerus. You know, humerus is the long bone of your upper arm, okay? And that's your humerus, and your femur is your thigh bone. So when you have fractures, okay, when the accidents of this nature, fractures in the humerus or femur, you can suspect that. Then linear type immersion bends. So you have a kind of bends on the child which looks very linear, okay? That means it was a planned one or it was done deliberately. You can suspect that. Then frenulum tears and gingival lesions. So frenulum can, I mean, depending on what you're talking about. Over here, we are talking about the mouth. So frenulum, we have lingual frenulum. That is the flap of tissue that holds your tongue to the floor of the mouth. Okay, that is lingual frenulum. We have I think one in your mouth too. That holds your lower lip to your gum inside your mouth here. So that one too is I mean your frenulum over there. You have one too at the upper lip. That holds the upper lip to the gum. So whenever you have any of the frenulum tears or any lesions around your gingiva, okay, how you pronounce that word. So any lesions around that area, you can suspect because areas like this, injuries are most of the times deliberate. Okay, injuries inflicted around those areas are deliberate. They are unlikely to be accidents. Then if you have subdural and epidural hematomas, you can also suspect. Then retinal hemorrhage on fundoscopy, okay, or fundoscopic exams. When the ophthalmologist view your eye and see that there has been maybe a retinal hemorrhage or something, it could be maybe a direct trauma deliberately inflicted, of course, which have to be looked into, okay? So that is what it means. And when you look at your right-hand side here, these ones are definitely signs of abuse. Okay. So the first one, shaking baby syndrome. You know, shaking baby syndrome those of you who have met this, though it's different, but those of you who have met this coup, I don't know how some of us will pronounce it, coup country coup or something like that. I don't know whether it's a French word. So those of you who have met that word before, it's different from shaking baby syndrome, but you have similar signs and symptoms happening. Okay, because at the end of the day, it's like, see, when you shake the baby vigorously, okay, the brain shifts, and you have, even though we have meninges and those coverings protecting the brain inside the skull, but you still can still have trauma, the brain hitting inside the skull. Okay, so that can cause neurological issues. So it's a sign of abuse when that is suspected. Burns in the shape of household items. So when someone or a caregiver brings the ward to the hospital, and you find out that there is a kind of burns that looks like maybe that has the shape of, let's say, a spoon or an iron. Okay, you can definitely suspect a sign of abuse. Then repeated injuries in various stages or varied stages of healing. So you have let's say fracture. Okay, you have, let's say, one arm. There was a time the person had a fracture, maybe at the lower part of the arm. Then another time there has been another fracture again, but just that the old one is healing. I mean, it's ahead of healing time than the next one. I mean, the current one. Okay, so when you have it in that pattern, you can suspect repeated um, abuse happening. Okay, or let's say if it's a wound inflicted, like an inflicted wound, you can see different ones at different stages of healing. When you see those things, so you should suspect what sign of abuse, right? Then the next one to talk about, lapse time between injury and time when care is sought. So you see, most of the times, those abusers, okay, those who normally engage themselves in these acts, they tend to delay healthcare. Okay, because sometimes it's out of fear. They might fear maybe they might be questioned or something. So they normally delay. So all these things we are mentioning, the benefits of them is that just keep them in mind. Nclex questions can come in different forms. So as soon as you suspect any of these things that we're mentioning in maybe any scenario given you, then you should just know that there could be an abuse in here. Okay. So that is why we are hitting on just the point. So just try and picture all of these things in your mind. Questions can come in different ways. The Nclex is very unpredictable. So just know the main points, and no matter how the question is being framed, you can be able to get it correct. Now, the next one is inconsistency between injury and caregiver's explanation. So let's say you have a linear form of burns, and um, the caregiver at the maybe emergency room, the caregiver tells you that the baby was trying to, like, the caregiver tries to give an explanation which doesn't match. Okay, it doesn't match with the current injury inflicted. You can just suspect an abuse. Okay, you can just suspect an abuse. If you have any question on this slide, you can ask before we move on to the next one. So you can ask by raising up your hand here, okay, for you to be called. If not, then I think we can continue. So, sorry, I had to overload um my screen, okay, or my slide, but I think we can see. So I had this table summarizing lots of them so that we can keep them in mind. So you have our left-hand side here, injury type, then what they mean, or like things you can see that suggest an abuse. So the first one here to talk about is bruises. Okay. So we are saying in non-ambulatory infants, it's a red flag. So how, like, let's say an infant who hasn't even started walking is brought to the hospital, and we later find out that maybe around the torso or other parts, we have bruises. Like, how can this happen in someone who hasn't even started walking? So that is one clue to it's a red flag, okay, to suspect. And the next one we have bruises found on torso. So the torso is like your trunk, okay, excluding your limbs. So anywhere around your torso, your ears, your neck, buttocks, okay, your buttocks or buttocks, buttocks, your back, your thigh. So we have a rule. We look at it, I think, on the next page. It's called 10-4 rule. Okay. We look at it. So what it means is that when you have any bruise around, so the T is torso, E here is ears, N is neck. Okay. For all people less than, we look at it anyway, all people less than 4 years, if they have bruises around these areas, you should suspect an abuse. Then bruises in the form of shapes like belts, marks, cords, hard prints, and the rest, you should also suspect. Then fractures, we've talked about fractures already, but let us look at, so we are pointing out more of those things that when we see them in questions, we can just suspect. We have rib fractures, especially posterior. Okay, yes, posterior. It is not easy for a child to fall on the back and break a posterior rib. Like, it doesn't happen unless someone intentionally, maybe, I mean, someone intentionally inflicted it or caused it. Okay. The next one is metaphyseal fractures. So part of the bone, I mean the edge of the bone, okay, metaphysis. So when you have fractures around those areas too in infants, you can also suspect. And multiple fractures at different healing stages. So this one I've already talked about. So that is it. Then bends. So talking about immersion bends, then bends which looks more designed, okay, or symmetrical, well demarcated. Those can't be accidents. So what I normally tell people is that when you are reading Nclex questions, even if the question seems easy, please take your time. Okay, take your time. I haven't, well, maybe I'm yet to meet someone like that. I haven't met anyone who has failed the Nclex exam. I mean, personally, who has failed the Nclex exam and has really admitted that the Nclex was difficult. I mean, the questions he or she met was difficult. You see the questions, you see that they are not too difficult. I mean, you have a couple of questions that maybe could be unfamiliar, but generally, you find out that there are questions you should be able to pass. But if you don't take your time, you end up, I mean, failing. The reason is that for even their wrong answers, okay, they calculate them well. So they know the mistakes nurses will make and they bring them among the options. So the wrong options will not go, I mean, way off road, something like that. It will be very, very similar. And they tend to bring I mean areas where nurses do commit mistakes. Okay. So if you see questions and you try to rush, the answer, your wrong answer that you think is correct, it's already there as part of the options. And you might be in a rush to pick it and you know. So it's like when you are feeling, you feel with confidence. Okay. Yes. So you feel with confidence and at the end of the day, it wouldn't bring anything good. All right. So the next one, let me see what. So the next one, we have head trauma. Okay, head trauma. So we talked about that one too already. Subdural hematoma, retinal hemorrhages. We talked about that when viewed under fundoscopy. Then skull fractures not consistent with fall. You have a certain fracture of the skull that doesn't. So let's say, depending on the age of maybe a child, and maybe you come to the hospital, you tell the healthcare provider or the nurses that this child fell from maybe um, a 2 feet, or let's say 1 feet bed. Okay. And looking at the degree of the damage, we can suspect, or the healthcare provider can suspect, that it's more than just a fall from a bed. Okay, and all of that. It could be that something was intentionally hit on the child's head. Okay. So that is how you fish out those ones too. Then abdominal trauma, liver or pancreatic injuries, they are all found in the abdomen. Then unexplained internal bleeding or perforations, suspect an abuse. Then delayed presentation, when they delay to bring the child to hospital, you should also suspect. Then oral injuries, we talked about that, torn frenulum and the rest. So you see there's another one here to add up. Missing or broken teeth. It's also one sign to suspect an abuse. Okay. Then bruising on the hard palate. That is also one way to suspect. Then genital or anal injuries. So when you have tears, bruising, lacerations, you should suspect an abuse. And STI in young children. So I've seen questions on this one before. The thing is, how can a 9-year-old female get an STI? So when you get an English question and the presentation is like you have a 9-year-old girl, or maybe a female out of age range of getting STIs, you should suspect that there's an abuse. Okay, so you should always be alert and look out for keywords. Like you can start practicing it now. You see, strategies in taking Nclex questions is very, very important than the knowledge that you learn. You can learn a whole Sunday's book and a whole U-word, everything, but you can still fail your exam. So, and I've seen someone I mean, let's say when you pick a question, let's say a topic like hyperthyroidism, you can ask the person like verbally any question on hyperthyroidism, the person can be able to tell you, I mean, word for word, everything. But just give an English style question on the same topic, hyperthyroidism, the person will get it wrong. Okay, so as you learn, you practice, okay, and see whether what you've learned, because at the end of the day, it's an exam that you're going to write. Okay, though you have to learn before you can write. But if you learn plenty without testing yourself, it's like a soldier training, I mean, without being tested. Okay, so you learn, those of us who are learning, and not practicing, or let's say not testing yourself to see whether what you are learning is having maybe a positive effect on your future exam that you're going to take, then it's like you are concentrating on one side, and that side alone will not help you. So you learn your content. That's why you see with our tuition, after every system, we have practice tests. Those practice tests is just to engage you to also test. You see, those of you who have realized most of what you meet in the test, they are neither in the books or the videos you watch, but they normally fall under the same system. So that's how your English is going to be. Okay. You're going to definitely meet things you've never seen before, ever since you started nursing. Or let me say, ever since I mean, you came to this earth. Let me say that there are some questions you would definitely, even right now, let it be that I should take the Nclex again. I will go and meet lots of questions. Even with all these experiences in this tuition thing, I will still see some questions I've never seen before. That is the Nclex. So the question is, what will increase your chance of passing? The practices, okay. I mean um the experience, that's the word I want to use. The experience you've gained, okay, in your reviews, how to fish out wrong answers, how to eliminate wrong answers, and you see all of those things that will help you. And if you know personally any recent test taker who has passed, you can ask them. I think everybody meets some. Okay, you meet questions you've never seen before, but out of your experience and those experiences you've built, you can be able to answer. All right. Then the last one to talk about here, I think it's not even showing you well. So failure to thrive. Okay, that is when you have malnutrition issues. Okay, poor hygiene. You see a child who is being brought to the hospital. Um, you have a child who is being brought to the hospital, and they tell you that, or maybe the question describes the child as maybe, let's say the outfit. Okay, the outfit of the child. Maybe person is wearing torn clothes, dirty clothes, and all of that. Anything describing poor hygiene. Anything describing poor hygiene should also be one way to suspect and neglect, and it's also one form of abuse. Okay, all right. So I think that will be all for now, unless someone has a question. So this is the 10 for rule things I was talking about. So these are just red flag, okay, for abuse in bruises. T for torso, E for ear. And like when you have any bruise around these areas in children less than 4 years old, straight away just suspect an abuse. Okay. Or any bruising. So this one for infants less than 4 months, any kind of bruising at all, you just suspect an abuse. Okay. So you're seeing these are high risk locations where bruises are unlikely from accidental injury. Accidents are there, but these areas they are unlikely. So I think we've talked about some of these things too. Yes, yes. And I think the last thing to add up here, recurrent ER visits. Okay, that's emergency room visit. So when you have one child who is being brought repeatedly to the emergency room, okay, with various injuries over time, then it's also um, a red flag. You should suspect it. Now, the question is, what do we do as nurses? What do we do when we have cases like this? The prime thing is to report, okay? But let us go through these things and see. The first one here is document everything objectively. So, injuries, history, and quotes. You have to document all of these things, okay? You have to document all of these things. Then, let's see. We are saying report the child to Child Protective Services. So we have ways of doing this reporting things, okay? Every state and every hospital have their policy, but at the end of the day, reporting is the key. Report to your healthcare provider, especially if injuries of different stages and those things are suspected or they are seen. Report to your healthcare provider, or if there's any option in a question like maybe you're in charge, just report. So the thing is report. Okay. Do you know that it is a crime? Okay. And this form of crime is like negligence, something like that. if you try to ignore, okay, if you are caring for a child, let's say a patient who has maybe any of these red flags we've talked about, and you fail to report, you are part of the crime. You can be charged, and it can even lead to, holding your license. Okay, so it's very important. All right, and always remember that the safety of the child is first. Okay, never confront caregivers directly in an accusatory way. Okay, so you focus on the clinical responsibility, your part. Don't don't judge them. Just avoid confronting them. Okay, avoid confronting them. So these ones, this part, you can have questions on them, and they are related to therapeutic communication. Okay, when we have time, some other day, we shall look at that therapeutic communication skills in different scenarios or cases. Yeah. So that's what we have to do. Any question here? Any question? So like I was saying before, normally, whenever I treat child abuse, I normally want to add spousal abuse or intimate partner violence, something like that. They are like they work hand in hand. Okay, there are some things which are similar because they are all forms of abuse. All right. So let me touch on that in a bit. Spousal abuse or intimate partner violence. There are Nclex questions too on these things too. So this simply means any physical, emotional, sexual, financial, or psychological harm by a current or former spouse or partner. Okay, so that is what it means. That is intimate partner violence. All right. Now we have types. We have physical one. An example, sorry, some of the examples under physical can be hitting, slapping, choking, restraining, use of weapons. So these are physical ones. Emotional, please, you just mentioned it. The English will not ask you um, what are the types, okay, or what are examples. We're just mentioning them here so that at least they can resound in our minds and visualize them whenever we meet English questions. That's why these things are there. Okay. So emotional type, we can have humiliation, threats, okay, insult, isolation from friends or family. So you see, when you have a partner who is isolating you from friends and family, that's also one type of abuse, intimate partner violence. So take note of sometimes those parts we nurses do not pay attention to. That's where the English normally will send you so that you get yourself thinking, is this one too a form of abuse? You see, you're asking yourself questions, and the more you try to worry your brains too will be getting tired gradually as you sit before your test, and you know what that can bring. All right. The next one, sexual. So it can be forced sex or reproductive coercion. Okay. Rape within marriage. So all of them are under sexual. So financial, controlling access to money, forbidding employment, financial exploitation. Some people do that, okay? They marry because of maybe their own game plan. They want to exploit the other partner. It can be from male to female or female to male, whichever. Okay, they control the access of money. It's like you have a small baby whom you are taking care of and all of that. Okay, they sometimes even forbid them from even working and all of that. So all these are examples of this financial abuse. Then we have psychological. Psychological can be intimidation. You always look down, like if it becomes progressive, okay, you look down on your partner, stalking, gaslighting, threats to harm children or self. So we can mute up when we join. And mute up when we join. Okay. All right. Sorry.
Yeah, make me a co-host, okay?
Okay. All right. So that is it for this one. Now, when it comes to the red flags to in intimate partner violence, let's look at this. So you see, you have the red flags on the left-hand side, then possible explanations on the right-hand side. So delay in seeking treatment. Delay in seeking treatment. So you can have so you see it's some of them are like that of the child abuse. Okay. That's why I like treating them together. So you can have a partner, okay, or you can have this, a poisonous relationship like this, and to the extent that the victim, before the victim can even seek for health care, unless they ask permission from the abuser, okay, and all of that. And the abuser would tend to determine when he or she thinks it's right for the victim to come for treatment and all of that. Okay, so the possible explanation is the fear of partner, then there's control. It could also mean that there's isolation. The abuser is trying to isolate the victim. So that's what it means. Then when you have injuries in various stages of healing. So you see, when you get questions, this abuse, questions on abuse, they are not difficult. So when you get them on your Nclex, they should be like a bonus to you. Just let them add up to your marks and go your way. Free, it's like a free marks. Okay. So just get them straight away. Child abuse, intimate partner abuse, or spousal abuse. When you get them, just add them to your marks, like free marks, and go your way. So when you have injuries in various stages of healing, they suggest what? Repeated trauma. It means the person is being treated in that bad manner repeatedly. Okay. The next one, frequent visits with vague or inconsistent complaints. So sometimes you can have the victim also coming to the hospital frequently, but they can't tell out their main issues. Okay. Or sometimes they might try to lodge a complaint, and you know it doesn't, what they say doesn't sit together with what is actually happening. So when that also happens, just suspect an abuse. Then partner insists on staying in room. You see this one? When partner insists of, let's say you get a case and you are trying to let's say collect data, or let's say yes, data from a patient, and you have this spouse who, I mean, seriously wants to be there. Okay. Seriously wants to be there during the uh, I mean, data collection processes and all of that. You should, even if you tell them to excuse themselves, they might try to still be like, they'll find a reason to be there. Okay, because they think they could be exposed by their victims. So they always want to be there. And I'm sorry. And with this one, I've seen a question on this before. Um, you see, the first time I saw the question, I was like, why should you lie to someone? So you see, even if it means to lie to the abuser for you to get the victim alone for questioning, I think it's better. So I don't know whether some of you have seen those questions before. You see, even though there is no indication that the patient will need maybe an X-ray or something, or a particular procedure, but you end up telling the abuser to step out because maybe this procedure has to be done and the patient has to be alone. Those answers are correct. Okay. Yes. Those of you who have seen those things before too, I think you can testify. So anything, they are already abuses, even though you are staying true to your work and veracity issues and all of that. But the person in question here, or the prime person at hand, is the victim. Okay. Then the last one here, fearful or anxious, okay, or submissive behavior. So when the victim shows, like, you see that this patient is too submissive, like the submission level to the caregiver or the person who brought him or her to the hospital is too much. Like, I mean, it's overwhelming. This is like too humble. When you see that, like too submissive behavior, you should suspect. Okay. You suspect. So most of the times they are emotional trauma. It could be that maybe the abuser has told the wife. So let's say the abuser is the man. Most of the times the abusers are men. Not all at times, but most of the times. So let me pick it that way. And let's say maybe they have some case around, and it could be that the man has been abusing the woman, okay, and it has gotten to a state that the woman will need health care. When the man takes the woman to the hospital, before that, the man can even give a strict warning to the woman that if she ever gives any history or she ever tells what really happened for her injury, that will be the end of the marriage. And because of maybe personal issues, maybe because of the case or because of the maybe a special love that the woman has for the man, okay, maybe the woman will try to just condone, okay, and be very submissive and move in line with what the abuser tells her. So that is one form of emotional trauma. So these are red flags. Okay, when you see them in questions, take note. Now, what are we supposed to do? So at the end of the day, how we address the issue is what the Nclex will normally ask. Normally Nclex question comes, about 80% of Nclex questions or 90%, they come in two forms. You have, they come in two lines most of the times, okay? You have a preamble, then you can study, you can check out for what I'm saying. Not all questions, but most of the questions, most of them are in two lines, except maybe NGN questions and, different, but simple standalone questions, they come in two different forms. Per question, you have a first part being a preamble. Okay, that will give you an idea. That is also one strategy to also fish out correct answers. Okay, strategies in answering English questions. The first part will always give you an idea what the answer should be. Then the second part of the question is the question itself being asked. Okay, let me try and give you an example. Let's say you have a patient with ascites, okay, maybe liver disease or heart failure. It's a chronic heart failure. Liver disease and heart failure, you can tend to have ascites, fluid shift into third spaces, especially when it gets to the abdomen, you can get this ascites. So you can have a patient like that. They can tell you maybe you have a patient with heart failure and there is ascites. Which of the following? Okay, and so let me frame it well. A patient with heart failure with ascites and having difficulty in breathing. What will be the priority action for this patient? You see this question. Questions like this, for all the possible options, they can all be correct. Okay, so first one, you can have prepare for paracentesis, okay, for the fluid to be drained. That is one, it's correct. Second one, maybe raise head end of bed. Okay, that is true. The second one, monitor or assess patient's respiratory rates and breathing pattern. That is also correct. Okay. In fact, you do everything for this patient, all the options there, but they're asking you what's the priority action, or what will you do for the patient first? You know, it is the position. Everybody here knows that is the position. You raise head end of bed first. Okay. So that is how sometimes Nclex is. So what guided your answer? You know, the first part said patient has ascites and has difficulty in breathing. So you choose an answer that answers the difficulty in breathing question. I mean, that part. Okay. So most questions, when you link them that way, you can easily get lots of questions correct. So that is one trick. You can practice and see. Take your time, even if you know. Take your time when answering questions. And I always say that when you take your time through your whole test, I mean, during the main Nclex period, when you take your time, it is better to take your time and pass in maybe 150 questions, okay, than to rush and fail in 85 questions. You know, when you're not doing well at all, as soon as you get to 85, it will cut you. It won't even give you a chance to continue. It will cut you and fail you straight away. Okay, but when you take your time, I mean, to reach everything, I mean, the Nclex is 150 questions, so I don't know why you should even go there expecting 85 questions. If you cut at 85, it's either you did too well or you failed abysmally. Okay, something like that. All right. So what can we do? Our responsibilities to these victims in intimate or spousal abuse. Okay. The first one, the action. So you see the action and the explanation here. So the first one says screening. Now we should use tools like HITS, HITS. I think H is you ask questions like were you hit? I think H is hit. I is it insulted or something? Yes. And T is were you T is what? Someone should remind me. T is what? S is were you screamed at? Okay. So were you hurt? Were you intimidated? Were you threatened? I think T is threatened, yes. So T is were you threatened? Okay. So all these are so it's like were you hurt in the action? Were you insulted? Were you threatened? Were you screamed at? So that's the hit. Okay. Then we have danger assessment too. So these are things that you can use to screen to find out whether patient was abused or is under abuse. Then you have to document. The documentation is very, very important. Use exact quotes, please. It's very important. You just write what the patient said, not what you think it is. Be very careful with this one. Then you describe the injuries as you see, so objectively. So as you see, you write the size, the color, location, and everything. Then safety assessment asks about weapons, whether weapons, I mean, was involved. Then threats, children in home, escape plan, and all of that. Okay. Mandatory reporting. We've already talked about this. So you have to report it, whether you like it or not. Then you provide resources. So if the patient will need a shelter home or will need help, you can offer that too. Most of the times through hospital policies. Then do not force decisions on patients. You see, sometimes this thing too happens in real case scenarios. You can, you think you are helping someone, okay, but you end up endangering yourself. Some people are comfortable in the abuse that they are in because they know that, or they think there is no escape plan for them. So they are very comfortable. If you are dealing with such people and you don't take care, you end up putting yourself in trouble. At the end of the day, you'll be the third person and you'll be in a very hot soup. So you have to make sure that you empower patients. Okay, provide the information that you have at your disposal. Just tell the patient exactly as it is, empower clients, and leave clients to make their final decisions. Okay, so that is very important. Even if their head is cutting off, at the end of the day, let them call their last shot, but you help them, provide them with every information that they need and all of that. Okay. All right. So that ends, that's very quick. That ends spousal. So you've done two things right now. Intimate violence, intimate partner violence, right? That's spousal abuse. You've done that one, and we've also done child abuse. What to suspect, things we see, like things when we see in questions on the Nclex, we should suspect abuse, and what to do. Okay. We shouldn't be judgmental enough. We should report exactly as it is. We should empower patients and all of that. Okay. So if you have any question at this time, you can ask. If not, I have two questions each to ask you. So two questions for the questions are very easy anyway. Two questions for child abuse and two questions for intimate partner violence. If you have any question here, you can ask. Any question? But are we here? Today it's like we are all quiet. Are we okay?
Yes.
Yeah,
Please,
good.
please,
Yes,
what
sir.
did you
Okay. My first question, if there's no question, then can
please, what
someone
did
read
you
this one out?
sorry, what did
If
you
you want
say
to
the
talk,
full meaning of it
kindly raise
was?
up your hand for us. Okay, so that's, but you can go ahead anyway. Can you hear me?
Yes, I can get you. I was asking that, please, what did you say the full meaning of hit was?
Hate. What do you say hate was? Were you hurt? Were you insulted?
No,
Were you threatened? Were you screamed at? Something like that. You get it? Sorry for this one. Did you get that? Are you okay?
mm-mm.
All right.
Please say it again.
Were were you hurt in the process? Okay. Were you, well, I think when you even Google, you will see it. Were you insulted? Were you threatened? Were you screamed at? So hurt, insulted, threatened. Sorry, yes, threatened, screamed at. You get it?
Yes.
Okay, so
Thank
let's look
you.
at. You're welcome. Can someone read it for us?
Okay, I go.
All right.
A nurse is assessing a 9-month-old infant in an emergency department for irritability and poor feeding. The parents state that the infant just fell off the couch. On examination, the nurse notes a bruise on the infant's back and a healing rib fracture seen on the chest x-ray. Which action is most appropriate for the nurse to take? A. Document the findings and discharge with parental instructions. B. Inform the parent that the protective service will be notified. 3. Ask the parent for more details about the fall and explain the injuries appear consistent. 4. Notify the healthcare provider of the findings immediately and follow reporting protocols. The answer is 4.
Okay, Mr. Sheila, I like your voice. That's the voice I'm trying to learn now. Okay. I like the I like the voice. So please who wants to try? I want the class to be lively enough. So you can kindly put up your hand and I'll call you. Okay.
I chose 4.
All right. Let me pick about 3 more so that we can carry on. Who else wants to try?
I want to try.
Franklin.
Yes, please.
Okay.
I'll also choose 4.
So your reason, frankly, let me get a reason from you. Why did you choose 4?
Yes, I think we learned that all the other options, for instance, to discharge the client means that we are sending the infant back to the same environment where the abuses were happening, and then to just inform the parents about child protective services
Services, okay.
that they will be notified also doesn't solve. And then now on the third one, to ask the parent more detail and explain that the injuries appear consistent doesn't also solve the problem. So I believe the fourth one is by notifying the healthcare provider and then you report.
The report is even there. Okay, it's Sheila. Thank you very much, Franklin. It's Sheila, your hand is up again.
Yeah, I just wanted to clarify that the question, first of all, we have to know if it was intentional or unintentional before we can take an answer. So this
Okay.
question gives us the idea that it was like kind of intentional because of the healing thing, that it didn't bring it immediately to the attention of the healthcare provider.
Okay, thank you very much for that addition. So you see how the presentation will always come in. So when you get English questions and you read them like this, okay, you see what the parent is saying is different from what is really happening. They are inconsistent. So you can just suspect. And after all, when you suspect, you know the first thing to do, right? So I think we are all correct. We did well this one. I think, is it like I said, when you get questions on these ones, they are very easy. You should be able to get all of them. They are like bonuses to you. Okay, no matter how the question has been framed, the Nclex will try to use unfamiliar words. Okay, but just take your time, look at the question very well, and you get the answer. You get the answer staring at you. All right, let's pick another one, a second one, and of course our last one on child abuse. A reader. Can I get a reader? Someone to read for us.
Okay, can I read?
Yeah, you can go ahead.
A school nurse notices that a 7-year-old child frequently comes to school hungry, wearing dirty clothes, and has poor hygiene. The child states, "Mom locks me in my room when she goes to work, and I can't eat until she comes back." Which findings indicate suspected neglect or abuse? Select all that apply. 1. Poor hygiene and inappropriate clothing for the weather.
Okay, so
Reports of being lost.
Franklin, kindly hold on for us. So what I normally want us to do whenever we get to select all that apply is that we all choose together. Okay, we all choose together. So when you read option 1, and those of us who think it's correct, we can let us know. Okay. Uh, so the first one. So I think he has read the question already. We know which ones we are choosing. So you see, this is the preamble. The first part is the preamble. Then there's the question itself. Like what I was trying to say initially, which findings indicate suspected neglect or abuse? So the first one, what do you think? Is it a yes or a no? Let me use my pen here.
It's a yes.
It's a
So it's
yes.
part right.
Yes.
Okay. Then option 2, the next one.
Yes. Yes.
Okay. The next one.
Yes.
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 Okay. Then the fourth one.
No.
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 Are you sure?
Yeah.
Yes.
I
No.
said no.
Okay. You got not all children like school, eh?
Mm.
Then the last one. Someone can
Say
just
yes. The
Yes.
last
okay,
one
this is
is
it.
yes.
Someone
Yes.
can just relate option
Yes.
4, eh? Someone's child today
Yes. Oh.
was behaving such way, right? Okay, so I think we are all agreeing to 1, 2, 3, and 5, eliminating option 4. All right, so let's check it out and see. Yes, so we are correct. All options are correct except 4. So that is it. They're very easy. Okay. Now let's take last 2 questions on the spousal abuse. Someone can read for us.
A 34-year-old woman comes to the clinic with facial bruising and a fractured wrist. She states she fell down the stairs. Her partner insists on remaining in the room. What is the nurse's priority action? 1. Document the injury and explanation given. 2. Ask the client if she feels safe at home. 3. Request the partner steps out to complete a private assessment. 4. Report the injuries to the police immediately.
So what's the best shot here? Tina, your hand is up.
3.
I'll take number 3.
You take number 3.
Yeah.
Okay. Give me a reason and let's see whether you get supporters. Then we carry on.
Okay, so with the one to document the injuries and explanations given, you have to do it. But we are asking about the priority, the number one thing you can do if you are to set aside all the others. So you ask the client if she feels safe. You can ask that in private, because if you ask that in front of the abuser, she will say yes. So you not get the right answer. But if you request to separate them, then that one he or she will feel safe enough to answer all your questions correctly. And
Okay.
you reporting the injuries to the police, if you don't follow the right protocol, as you say, you might put yourself in danger. So you have to make sure that everything that you are doing is through the books before the police even comes in. So I would choose number 3 first. That's
Okay.
what I would do.
Okay.
Please,
We all agree, right? Or you know a different answer?
no, please, I have a request.
Okay.
Please, some of us are at work. We are not watching the screen. We are only listening. So we want to request if everything can be read. Like the previous question, we didn't know the options. I didn't know the options that were picked because all options were not read.
Okay. Okay.
Thank
All
you.
right. We will read them again. We will read them next time. Okay.
Okay,
All right.
thank
All
you.
right. Thank you. All right. So I think we all agree, right? Option 3. Who has a different answer? I think we all agree. So that's the rationale. Okay. So you go through them quickly. We look at the last question. Then we move on to an entirely new topic. Okay. Erida, can someone read for
Oh,
us?
okay, I'm reading.
All right.
So, a 28-year-old woman visits the clinic for a routine checkup. During screening, the nurse notices old bruises on her arms and asks about them. The client hesitates, then quietly says, "Sometimes he just gets angry, but it's not that bad." What is the nurse's best response? So, option A, you should leave him immediately before things get worse. Option B, second option, tell us more about what happens when he gets angry. The third option, I have to report this to the police right away. And the fourth one, do you want me to call security in case he comes here?
Okay. So who wants to try this first? And your reason. So you tell me with rationale. Who wants to try? You can raise up your hand here. Takujimia, your hand is up. Then after Stashila will come.
Okay, boss. Thank you very much. So I'll go in for option 2. Tell me more about what happens when he gets angry. This option is open-ended and is going to give you more information about what the client is going through. So I'll go in for that one.
Okay. That's very simple and short. Stashila, thank you.
It was the same thing I was gonna say. that
All
is
right.
open-ended, and it makes you explore more about the patient, what the patient is going through.
Okay. So let me hint on one Nclex tip here. If you want to get therapeutic communications too well, just keep this in mind. Listen to it very well. When you keep it, it will save you lots of trouble doing lots of researches. When you have people with let's say sound people, like I mean they have just normal medical conditions, like generally, and it's like a therapeutic communication question. Always ask for open-ended questions so that you can get more information about what is happening. Okay, that is one part of it. Now, there's another part of it where open-ended questions will always be wrong. You only have to use close-ended questions, and that is for patients who have issues with maybe neurological issues, right? Not all neurological issues, like
Alzheimer's,
something like can you mention some
Al-
like dementia?
Alzheimer's disease.
Good.
Yeah,
Alzheimer's disease, dementia. You know, dementia and Alzheimer's is like they're like twins. Okay, you definitely have it said. What else? There are there are lots of conditions like that. So any conditions that
Suicide,
alters, come again.
suicide attempts or suicide ideations,
Uh-huh,
close-ended
yes,
question.
yes. So any form of disease state or any condition that has issues with maybe the patient's mental orientation, okay, don't ask open-ended questions. Ask close-ended questions to get simple answers. Okay. Uh-huh. So that is the difference between the two, where you use the open-ended and where you use the close-ended. Is that Priscilla? Your hand is up.
Yes, but yeah, I want to find out in abuse cases. I
Mhm.
know you have to inform the authorities about it when a child or a spouse is being abused. In that case, do you inform, let's say if it's in a case of a child, do you inform the parent that you are going to report, or you just report
Yeah,
without
so
letting them know you'll be reporting?
so I think this part is not being tested, but it's optional. Okay. You see, why do I say this? When you tell them before you go and tell whichever, or let's when you tell the caregiver or the parent before you go and report, you've done your right thing. If you don't tell them and you go ahead to report, you've also done your right thing. Okay. So what is more prime here and what makes it wrong is not reporting at all to their rights. So there is no obligation that tell patient that you're going to report or don't tell patients. I think it's optional. There is no regulation like that. But the end part, which is the reporting to appropriate um, bodies, you will have to. I don't know if you get
Okay.
what I'm trying to say.
Yes, I was asking not actually for the exam, but like in practically.
In practical, yeah.
Yeah,
So
applicably.
sometimes let's say if the care has been very cordial, the parents they are not shutting themselves off, and they are like at the healthcare scene, they are showing like some kind of care and they are involved. They look cheerful and the rest. If you vibe with them, you can let them know that maybe because of this, it's mandatory for you to report. I mean, or you can choose to not even say anything and go ahead and report.
Okay,
Okay.
thank you.
Yeah. All right. So that is correct. That is correct. That is correct. Now, we look at our next thing here. Dumping syndrome. Dumping syndrome. This is also one of the things that normally come to the English, right? So what comes into your mind when you see this thing, dumping syndrome? Let's look at it in a bit. I've tried to make it very, very simple. So open your minds, open your ears. Those of you who have issues with dumping syndrome, it's my prayer that after this one, you will not have any issues again. Okay. So when you have dumping syndrome, think of stomach issues. Okay. Your stomach as an organ issues. We are saying it occurs when gastric contents move too rapidly from the stomach into the small intestine. Okay, usually after gastric surgery. So all these forms of gastric surgeries, please pay attention to these ones too. You can write them down. I'll say something small about them, but pay attention to them. You can have them as your major questions somewhere, maybe in case study questions or something. Okay. So we have B root 1 and B root 2. This B root was named after, I think, the renowned surgeon who did this thing first. So B root 1, B root 2. It's like partial gastrectomy, something like that. I'll show you pictures and use it to explain, okay? Gastrectomy is where you have all the stomach being removed. Okay, the organ itself, everything being removed. That's gastrectomy. We have Rosen Y or gastric bypass surgery. This one, if you've heard of bariatric surgery before, it is the same as this. Okay, bariatric surgery. I think it's in Nclex. So when you see these things or you see bariatric surgery, it's the same thing we are talking about. Those people who don't want to gain more calories and for fat people, okay, it's like a weight loss surgery. Yes, so that is it. And I'll explain what they are in the next slide with a picture. Then B root 1, B root or B root 2, 2. So in all, what we are saying is that at the end of the day, parts of your stomach or all among these three will be removed. Okay. And when it's being removed, we have to, it's like resection and anastomosis. When you remove, you just have to join a section of the small intestine to the parts removed and the parts coming from the esophagus. Okay, you have to join them. Then, they all come with their own issues. So this is damping syndrome. When you have damping syndrome, it occurs when you have gastric content moving to, so it's like when you put food into your mouth, it has to fall into the stomach and rest for some time. You have gastric content like, I'm coming, Del, I'm coming, okay. You have gastric juice and those gastric enzymes pouring on the food to help even in one form of digestion. Okay, digestion of proteins starts from the stomach, right? Major ones start from the stomach. We have few ones very tiny ones there in the mouth, but main ones start from the stomach. So when that happens, when there's a gastric surgery, it means all these gastric juices or gastric enzymes will not be present in there. Okay, so anything you eat will just rush directly or faster into the small intestine because your stomach has been taken away or part of your stomach has been taken away. So what happens is what we call damping syndrome. So it's like you've dumped food or content right from your mouth into your intestine straight away. So you can understand it in that way. So it's like damping syndrome. Okay. If you have issues understanding it, just understand it that way. Damping syndrome. Del, you can ask your question before I carry on.
Okay, please can you hear me?
Yes, I can hear you.
Please, you mentioned bariatric surgery. I wanted to know, is it the same as gastric sleeve?
Is it the same as I can't hear the word well.
Gastric sleeve.
Gastric sleeve.
Yeah.
No, I think it's a part of gastrectomy. I think that one will be different.
Oh, okay.
I think when you Google, you will see it. I think it's a side. It's like the removed side of the stomach, rather. Someone can find out and tell us.
Yeah,
Sheila.
they talk parts of this.
And
Yeah, gastric sleeve is when they take out like
They take what?
a portion of the stomach.
So
Yeah, it's the
gastric
same
sleeve is different. Yes.
gastric bypass. It's kind of
Yes.
like the same as the gastric bypass.
So it's a form, not the same.
Maybe
It's a form.
type, yeah.
Okay,
You
thank
get
you.
it. We have different forms of the bypass. So, you see, gastric bypass. We talk about it, and you see how it's being done. So there are different types, but the purpose is what most of the times will give us the name. Okay,
Okay, thank you.
you're welcome. Yes, any other question? Okay, so let me explain these three here in a bit so that you'll appreciate what is going on. Okay. So you see B root one. Remember, I've already said that with the gastrectomy, you have all the stomach being removed. Okay. But B root one, you have lower parts. Okay. Most of the times the antrum. Most of the times is the antrum or the lower part of the stomach which is being removed. Right. And after it will be anastomosed with the rest of the intestine, like you see here. And B root two, sorry. With B root two, you have major portion, okay, major portion of the, so you can see, major portion of the stomach being removed. So in this case, you see, there's the colon, right? Transverse colon. The big organ is here. That's the transverse colon. Then there's the small intestine. So you see, they cut off the intestine from here. So it means this part of the intestine, the small intestine will not be working. Okay. And they've joined with a distal part. Okay. Uh-huh. Just the stomach, so that any content that drops here will not go through all these barriers, but rather enter here, then carry on. So this is B root two. Then so
Please, I want a question before you continue.
okay, Franklin.
Yeah, please, for instance, in the bill road 2, we realize that majority of the small intestine is left before being joined somewhere, let's
Yeah,
say in the middle. Does the portion that is still left in the patient,
yeah. So
or it will be cut?
I think it will be cut off. I'm sure.
Oh,
I'm sure.
okay.
I'm sure. Well, if it's left there, someone can find out, and I don't know. I don't know why you should leave a portion there, because okay, it will be supplied to. You see, it is attached. It is attached to a main organ. Blood supply will be there. It will still be alive. Maybe it could be cut off, or maybe it could also be left. It will not rot because it has blood supply. Because what will happen here? I don't know if you agree with me. What will happen here is the same as what will happen here in terms of blood supply. Do you agree with me?
Yeah.
Because they all pick it from here. Do you get it?
Yeah. Yes.
Yes. So I think it can also be left there. This one is
Oh,
like
okay.
surgical specialist, right? I don't know how it's been done, but I think they'll still get blood supply. Yeah. So the right hand side is um the bariatric surgery, this reason why surgery that we're talking about. So you see, they will cut a greater. So you see this part highlighted blue. So in this case, we will cut all of these ones, okay, and throw it away. Then join the distal part of um the intestine, right? We just attach it to the small portion left. Sometimes I think some archives even describe the pot to be like the size of an egg, very small. Okay, they leave just small parts. The reason is that they don't want those people to um get in more calories and all of that. Okay. So that is why. So at the end of the day, the left-hand side, that's A, is the original one. Then after the surgery, this is how it's going to look like. All right. So those things you saw here is what we've talked about there. So you see, in all, not forgetting we are talking about damping syndrome. In all, it's going to shorten your stomach one way or the other. So when you are, let's say when you get case study questions and they start telling you maybe the person has gone for surgery because of maybe perforated peptic ulcer. When you have a serious peptic ulcer, complicated one, they can do this gastrectomy procedures for you, either be route 2 or like they can remove a section of where it has been, where it has been eroded. Okay, they can do this kind of surgery for you. So think of peptic ulcer too. And when it comes to peptic ulcer, you have part of the intestines also involved. So that part and the parts of the stomach which have been involved, they will all be removed. And it's like um resection and anastomosis, right? So it will be done. So think of those things when you get conditions like that, and they tell you that patient has been having these symptoms. You look at the symptoms very soon, and that's because of that. You just know that it is damping syndrome which is happening. So you see, one thing that can help you if you are getting ready, you're almost ready for Nclex, is that when you are doing, let's say, case study questions and you read the preamble, you should have an idea of what the question is talking about. That is one thing that can, when I started Nclex at first, I wasn't like that. But it's got to a stage, those things started coming in, and I knew, yes, I was ready. Okay. You get to a stage and you'll be like, you read, a preamble, you start reading. And of course, during my time, it was the old generation, not the NGN. But you can get a simple question. When you read the first part, you can just suspect that this thing is happening. But please, like I said already, take your time, don't be in a rush, because what you think it is, which of course it isn't, you have the answer there. Okay, so you have to take your time in choosing your answers and the rest, because especially for those of us in Africa and not in South Africa and in Kenya, you will have to travel, take a flight. You can't afford all these struggles of journey, rigors of this hard work and money. Even if you have an agency sponsoring you, you can't just go and throw your chances away and come back. So prepare well before you go. Okay. So get to that point. Like, don't treat the Nclex as a part-time job. If you treat it as a part-time job, the Nclex will also treat you as a part-time student or a part-time nurse, and it will not give you the attention you need. Those of you who have gone through the stages up to a level, the Nclex is it's a serious business. And I can promise you that sometimes the stress it gives you, it's more than you attending the physical school. And in this case, you have short time to do the Nclex. Over here in the US, it's what people do in the nursing school when they go there for 4 years. They go and do all of these things. And even over here, sometimes they even still fail. Okay. When you look at reports upon reports, like yearly reports, international students or international nurses pass the Nclex more than the US nurses. You can check it out and see. So we saw this and someone was like, why? How is it that how is it that way? So one funny thing someone said was, if you are from some parts of Africa, where you struggle to even get um like 3 meals per day, and you start this English process, you just will be reminding yourself where you are coming from, and you use all your energy for this thing. So what I'm trying to say here is, just don't treat the English as a part-time work. Okay. If you treat it well, it will treat you well. At least just for about 4 to 6 months. Thereabouts. Just sacrifice. If you don't make sacrifices, you will not get it. So just put it in your mind that you have to make sacrifices. You have to, this one, it's a must. Otherwise, you write and write and write, you'll be wasting money, time, and all of that. But if you break, like, no one is free, everybody's busy. That is why I always call it sacrifice. So you have to put down certain important things, which are also important, and prioritize the Nclex. Of course, you not do the Nclex forever. It's just for a short while. When you are done, you pass. Those of us who pass the Nclex this week and last week, I don't think they've even picked a book to even look at it again, right? An Nclex book. So why don't you put in all your energy and get to that stage so that you fall in the immigration line? Normal life continues. Okay. So back to dumping syndrome. Okay. We are making it easy here. So um let me repeat this once again. It's saying it occurs when gastric contents move too rapidly from the stomach into the small intestine. Okay. When gastric, this comes from the esophagus, from mouth esophagus. So when you have gastric contents coming, yes, gastric content right from the mouth esophagus, it gets to the gastric content. It gets to the gastric organ. It has to stay here for some time. Okay, for gastric juice and some form of digestion to take place here before the chyme. When the food mixes with the gastric juice and the rest, it's called chyme. Okay, before it gets to the intestine, chyme, chyme. Those of you who have seen that word before. Yes, so it has to stay here for some time before it gets to the small intestine. But because people who have had gastric surgeries, whether gastrectomy, B-root 1, B-root 2, or Rosen Y gastric surgery, because they've had these surgeries, food quickly rushes, okay, into the intestines straight away, and they get a lot of issues. So that's the issue we are talking about, and we are looking at it extensively. So that's dumping syndrome. I hope we have the idea of what's happening here, right, in dumping syndrome. So to summarize what I just said in pathophysiology, we are saying rapid entry of hyperosmolar chyme. So like I was saying, when you chew food, it gets into it passes through the esophagus. Peristaltic movement will take it through the gullet or the esophagus and get into the stomach. When it gets to the stomach and it mixes with gastric juice and all of that, enzymes, when it's ready to enter into the small intestines, it's called chyme. Okay, so that's the word you see here. And we are saying rapid entry of hyperosmolar chyme into the small intestine causes fluid shift from blood. So you see, the concentration of the chyme becomes higher because, over there, because portion or all the either portion of the stomach or all the stomach has been removed, the digestion which has to take place in the stomach is being spared. So nothing happens in there, and they have their original concentration in there. So they tend, how osmosis happens, movement of water molecules, right, from a region of a lower concentration of solids, right, to a region of higher concentration of solids across semi-permeable membrane, right? So that is what happens here. So you have the chyme drawing more fluid. So you see over here, you have the chyme drawing more fluid from the blood into the intestines because the concentration of the chyme coming has not been broken down and it is concentrated. So it tends to pull a lot of fluids from the blood into, the lumen, the first part, okay, the lumen of the intestines, they are highly vascularized. Okay, so that's how the water, okay, or the fluid parts get pulled from the blood directly into the small intestines. And when you have fluid leaving the blood, you reduce cardiac output too, in a way. You reduce blood volume, and that will eventually cause what? Hypotension. All right. So in damping syndrome, this is what is really happening. Because there's a rapid movement of chyme or food into the small intestine, there's fluid shift from the blood into the intestines, and this causes what? Hypotension. And because um, the food hasn't been broken down up to a point, okay, and all of them just fall directly into um all of them just pour into the intestines. You have rapid insulin release. You know, the body will be forced to produce lots of insulin to counteract, especially the carbohydrate part. Okay. And that can eventually also, the surge is high. Okay, the surge is high, but it occurs later. That's why we are saying, especially in late damping, but not in early. So you later get what? Hypoglycemia as a result of that. Any question at this time before we carry on? Are we following? It's like you are too quiet. Are you following?
Yes.
Okay.
Yes, please.
All right. Now let's look at types. So there's a trick here too on the Nclex. Most of the times, early signs of most of, not all, okay, that's what I'm saying, it's a trick. Most of the times, early signs of lots of things, you have GI symptoms dominating. So think about lithium toxicity. Let me see how someone will pronounce this word too. DI, okay. Someone should mute up for us. How do you pronounce this word? My mouse is not writing well, but you can see at least DIG.
Digoxin.
Come again.
Digoxin.
Good. So you see, we have lots of pronunciations. You see,
Is it
uh-huh.
digoxin? Digoxin.
Digoxin.
Good, good.
Digoxin.
So this is one of my favorite parts. I like how the Nigerians and the Kenyans pronounce it. Okay. Uh-huh.
Digoxin.
Definitely a Kenyan, right?
Digoxin.
The
Digoxin.
jugs. Okay. So someone will say digoxin, digoxin. I mean, however. So
Okay, now.
it's a noun. Good, good. So this one, lithium and lots of things. Okay. This one is just a trick. If let's say you are asked in a question, and they ask you what will be early signs and symptoms of something toxicity, and let's say you don't know, you are not even sure, please, if there is anything that relates to GI symptoms, pick that. You are, I mean, you stand a high chance of getting it correct. Okay, so let's say you have lithium toxicity question and they ask you which of the following is shows that the patient is having early signs of lithium toxicity: nausea, vomiting, diarrhea. You see these things, like any GI symptoms there, but always go for nausea and vomiting first. Okay, before the other GI symptoms. That's if you don't know or you are not really sure. You stand high chance of getting it correct. So, types of damping syndrome. We have the early one and the late one. Sometimes the late one you see maybe 1 to 3 hours. This is 1.5 to 3 hours. We are still within the range. Okay. So with the early damping syndrome, it occurs mostly within 15 to 30 minutes after eating. Okay, and this is how you see them after within this time. So please pay attention to these tips for case study questions, so that when you are reading the case study questions, you look out for some of these key things, okay, to know what is really happening. After they normally get the symptoms after eating. So if it's early signs, it occurs within 15 to 30 minutes, and you normally get GI symptoms. Okay. Then with the late ones, it occurs from 1 to 3 hours. Okay, and you see mostly the hypoglycemia symptoms. So that is just to inform you about the types and point to suspect symptoms and signs. Okay. Can we carry on? Now, some of the symptoms. So with the early symptoms, we can see we have nausea and vomiting, we have abdominal cramps, diarrhea. So you see, most of those things here are GI symptoms, right? Even bloating is a form of GI. So you have tachycardia and sweating, dizziness or syncope, which is a bit different. Okay, but it's also part of the early signs. Okay, so you see them, sweating. Okay, if you don't see sweating, then you see diaphoresis. It's the same thing. So don't let the words trick you. Okay, don't let their weddings trick you. Okay. Now let's look at late signs of damping syndrome. You have weakness, sweat. So you see, the late signs, at least try and picture hypoglycemia. So this is also one trick. If you know your signs of hypoglycemia, just throw away everything and associate it with what late signs of damping syndrome. You remember we said it here already that with the late one, it's usually what hypoglycemia symptoms, right? And the earlier ones is the GI symptoms. So let that trick guide you. So with the late symptoms, when you get a question, maybe a follow-up question in NGN, maybe NGN type of Nclex question, which of the following shows the patient is having late sign of damping syndrome, going for any hypoglycemia sign. Okay, going for any hypoglycemia sign. And if so, you see, if you don't check out for the adjective, either late or early, you can be tricked. And it wouldn't be that you don't know, you know, but you will fail. Okay, so paying attention when solving questions is very important. And please, if you are yet to test, okay, I always say start practicing. Like any test you do, even if it's 10 questions, take it as your main English question. I mean, start being serious right now. Like the main, take it. I don't know how to even say this. Like mean it. Sit in front of your computer like you are in the English room. Okay, doing it, no distraction, and see. There's one thing I've realized. Your your reflection, okay, or let me say your practice right now is a true reflection of what you might get on your English. Okay, so try and better it. Have that. If yours is fear, overcome it and get on top of this game before you go. Like work on it. It's a computer you are going to use. If you have a computer, it's fine, so that at least the settings becomes like that of the main English. It's better to use a computer than to use phone. Then if it's a kill bank and please, this is a free advice to everyone, whether you are USRN elite student or not. And I think for our students, you are already aware of this. Try hard and severally solve a lot of questions at a given time. Okay. At a given time, no breaks. Don't take any break. I mean, the only break you should take is maybe when you're going to use the washroom. Yes, that one is allowed. But break to eat, forget about it, and after you can eat. Or maybe you can eat before you start. Then make sure it's a time that you'll not be interrupted. So you know your personal schedule, can choose whichever. Okay, at dawn, if at dawn works for you, maybe because of your case or your conditions at home, that is fine. Like, but try several times. Um, I've known someone, previously about 2 years ago. The person was very good. Give this person about 20, 30 questions. The person could get about 28 or 27 over 30. But the first time I gave, I think 85 questions, or at that time, I think it was 75. The first time I gave 75 questions to this person, the person failed. I mean, the failure was like, I was like, did you do this thing yourself? And you know what I saw? The earlier parts, okay, the earlier parts, kindly mute the earlier part of the test, the person scored a lot. Okay, the person scored, I mean, the score was good. But I saw from 40 something coming. So I was like, did you really get this one wrong? I didn't understand. So the issue was the stress. Some people are good, but they can't just sit for about 2 or 3 hours to do plenty questions. And with the Nclex questions, as you do them, I think those of you who have started your process, you can attest to it. The more you do, the more your brain becomes tired. Okay. The more you do, the more your brain becomes tired. And that is one thing that secretly fuels people too. Hey, Lily, is it Lily? Please mute. Okay. So that is what mostly feel people, okay? The strength to carry on because each endless question, please, sometimes you can talk to those who have written before. You just try to appreciate what we are telling you. Every single endless question will let you think, even if it's simple, because the options are very, very closely related, and you have to be careful in choosing your answer. Okay. So um you have to try and overcome this kind of stress, mental stress in solving, sitting at, I mean, having just a sitting to do about 100 or more. Okay. The first time you tired, you drop off, but the second time, try and go, I mean, do well. Okay. Other than that, because the exam is 150 questions. So if you don't train yourself up to that level, you go and giving you questions up to 150, what are you going to do? You can't afford to go and fail and come back. So these things are practical. I mean, you will not see the relevance of it until, I mean, you get there. But if you start practicing now, I mean, no one will have to even talk to you, advise you, and you will have the confidence, you have the strength, and the mental strength is very, very important to be able to do because the first time I said, you see, everybody has a beginner stage story. Okay. I was this like I felt the same when I started my English process in 2020, 2021. Yes, that was when I started my English process. And it wasn't easy. You will learn and like, why is it not clicking? Why is it not clicking? 2021 January, I started right from the first month. So it wasn't easy, but with time you get better. So those of you who are already feeling downhearted, it's training. Get time for yourself. Mr. Lily, the next time you unmute without talking to us, I'm going to put you in waiting.
Sir, please can you put the early dumping syndrome? I didn't get all, please.
Okay. There's early signs. So early signs, think of GI. Okay. Okay, so I think let me put Sister Lily in waiting room. Okay. Please, have you seen it?
Yeah, thank you.
All right. So that is it. Okay. All right. So I think we can continue. So in short, early symptoms, think of what? Think of GI symptoms. Late symptoms, think of what? Hypoglycemia. All right. Let's look at what we have next. So apart from what is happening, there are some electrolyte issues that also go on. Please, with this one, pay attention carefully. Okay, it's very, very important. And I've made it easier here. Very colorful. You have the electrolyte on the left-hand side. Of course, glucose is not electrolyte. Then what is happening to them here in the middle and what you have to watch out for, okay, when they are happening. So what happens to sodium in damping syndrome? You get hyponatremia, okay, because you see, you are saying you have decreased hyponatremia, okay, or that sodium levels goes down from fluid shift, and you have diarrhea happening. So you lose both potassium and sodium from the, remember, diarrhea is one of the early symptoms. So as you having all those fluid loss through the diarrhea and those things, the fluid it leaves your body with these electrolytes, okay? It leaves the body with sodium and potassium. And when you see these patients with confusion or signs of weakness, think of low sodium levels. And definitely, you can find sodium levels to be less than 135. Most of the times, I think when it gets to 120, less than 120, that is more dangerous. Okay, that is where you have these things profound, the confusion, weaknesses, and all of that. So potassium too will go down. Okay. Uh-huh. Potassium. And the reason is from this same diarrhea and insulin surge. You know that potassium and insulin have inverse relation. You know that sometimes even in hyperkalemia protocol, when we want to let's say when someone has hyperkalemia and want to do hyperkalemia protocol, what hyperkalemia protocol means is we want to shift some of the intravascular potassium into cells, into intracellular. Okay, the blood itself has more of potassium, so you want to remove or push the potassium in the blood into the cells themselves. Okay, so that's what happens in hyperkalemia protocol. We use insulin and dextrose, right? More than 50% dextrose in adults. Yeah. So insulin and dextrose. So when someone is on insulin, okay, potassium levels are likely to go down because insulin tends to shift potassium into cells from intravascular space. Okay. And when you have hypokalemia, that's what you tend to have: arrhythmias, muscle cramps, and the rest, right? You have calcium here too. Calcium too will go down because of malabsorption. Okay. Because of malabsorption. The stomach also helps to absorb calcium. All right. So if, let's say, portion of the stomach has been removed, you're going to have issues with your calcium absorption. And this is how you see it manifesting. Tetany, paresthesia, you see all of these things, okay? Now, magnesium. Magnesium, so you see, everything will come down here. So it's a trick for you, okay? And how you see them is what have been written here on the right, far right-hand side, okay? So these ones have been made easier, very, 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 very easy for you to relate, okay? All right. Let me ask. I think this is one of the few conditions where you have potassium and calcium, magnesium all coming down at the same time. But generally, let me ask this. Generally, what's the relationship between calcium and potassium? So I'm asking this. You answer me in terms of directly proportional or inversely proportional. Who wants to try?
Directly proportional.
Aisha. Aisha. I think it's inversely proportional.
Uh-huh. I know
Or
an increase in one will decrease the other.
Would decrease the
yes,
other one, yes.
and vice versa. Okay.
And
Yeah.
vice versa.
So
Yes.
which
So
one
it's
is that?
inversely.
Inverse.
Potassium,
Inversely, yes.
potassium has an inverse with both calcium and magnesium. I think so. But especially for calcium and phosphorus too. Potassium has an inverse relation with phosphorus too. So just by the way, okay. If you have any question here, you can ask before we carry on.
Please, which one is an example of the direct
Okay,
proportional?
okay, so let's say when you have like inversely proportional or direct proportional. For the direct one, this is what we have here. But the inversely proportional ones, um, let's say in cases of in cases of chronic kidney disease or AKI, no, not AKI, like CKD, yes, chronic ones. Have you realized that most of the times when potassium, in CKD, potassium levels tend to go high mostly. Do you know that most of the times when potassium levels are high, calcium levels are down? Have you realized that?
Yes.
Most of the times, even not if not 100%, at least most of the times. Okay. Though, with conditions like CKD, things can change, but mostly when potassium levels are high, calcium levels tend to go down. So when potassium levels are high, you tend to give this thing. You tend to give what's the name of the drug?
Yes, please.
Containing calcium,
Calcium
calcium,
gluconate.
calcium gluconate. Good.
Calcium gluconate.
Yeah,
So
calcium
the
glucose.
main reason for
Calcium
giving
gluconate.
calcium
Yes.
gluconate is calcium gluconate is cardioprotective. Okay. So just to protect the heart from going into for having from having lethal dysrhythmias, okay, or for having dangerous heart rhythms like VFib and the rest. That's the main reason why when someone has extremely high potassium level, we give calcium gluconate. But do you know that in a way, it also helps to appreciate, because it's calcium in there, in a way, it also helps to appreciate calcium levels. And calcium itself, it also protects the heart. Okay, so if you understand it that way, you will appreciate it. So those of us on the ward, you can check and see if you are caring for someone with CKD, check the electrolytes. Okay, when they go in for electrolytes, when potassium levels are high, check calcium levels. They are likely, I wouldn't say 100%, but they are likely to be low. All right. Now, how do we intervene for these people? Okay, intervention. So you see, this is one of my favorite words. Small but frequent food. Okay, we want to slow. Please let me say this before I forget. Please, I don't know whether it's here. Okay, so it's not here. Let me say it before I forget. Please, when gastrectomy is done, remember that the stomach produces an intrinsic factor. Okay, that is vitamin B12, which helps to um to form red blood cells, and vitamin B12 too has neurological advantages. It helps with nerve functions and the rest. When people undergo this kind of surgery or any kind of surgery that tends to remove part of the stomach, please, they are likely to be on vitamin B12 forever. I think I just remembered. I didn't bring it here. So just keep it that way. Okay. And so when you see a question, let's say a question and it goes like someone with dumping syndrome, the person is having anemia and the rest. Where do you think the anemia is coming? It's coming because of deficiency of what? The intrinsic factor that the stomach should have produced, which is vitamin B12. Okay. Vitamin B12 is what? What another name for vitamin B12?
Is it cobalamin?
So
I want you
balance,
to start with it is, not it
It
is it.
is cobalamin.
It is. So cobalamin or cobalamin. Okay. So if you don't see vitamin B12 somewhere, you see cobalamin. Don't say it's a strange word. Okay. It is the same thing we are talking about. So the Nclex, they can sometimes change their words, but it's the same thing they're talking about. So with a diet, small but frequent foods. Okay. The reason for this is what? It's to slow gastric emptying. Okay. So when Nclex question goes like, which of the following statements, like you're educating a patient with dumping syndrome, which of the following statements made, if made by the patient, requires need for further teachings? And the patient tells you, I can eat my 3 square meals without having any issue. Please, it's a cause for concern. You can't eat 3 full meals. You have to eat more than 3 times. So you see, maybe eat small but frequent. There are questions like that. So open your eyes. Don't think 3 times, eating 3 times is okay. Okay, so the key word is small but frequent. Okay. So that helps to slow gastric empty because you don't want food to move into the intestine straight away faster. Okay. And with the food, when you ask about diet issues too, high protein foods, okay, and low carbohydrate diet. Please, low caloric diet too. If you don't see carbohydrate and you see maybe calories. So let me explain this one here. We are interested in should I say polysaccharides, right? Like complex carbohydrates. Complex carbohydrates takes time to break. Okay. And they take their time to break down and they release their calories small. Simple sugars and like monosaccharides and disaccharides, they are no-go areas. Okay, like simple sugars. That's why it's even written here. Avoid simple sugars. When you eat them, you get this, the early symptoms right now. Okay. So that is how it is. Okay. Then we are saying avoid fluids with meals. So you see, avoid fluids with meals. What it means is that when you are eating, don't 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 drink whilst eating. Okay. There's a statement, one particular sentence that normally confuses some of us. When you see drink in between meals, please, that is a correct statement. I'm repeating that again. Drink in between meals. It doesn't mean that when you are eating, you pause and you drink. When you are eating, that one is in line with what? Fluids with meals. But fluids in between, or let's say drinking in between meals means, let's say you've eaten, you are done. After about 1 hour, you've taken small amount of fluid, okay, or water. Then maybe another 2 or 3 hours, you eat again. You see, that is in between meals that we are talking about. You see them. I don't know if someone's here and has already seen a question like that before. You can attest to it. So always be guided. You will see those things around. When one day when you see a question like this, you remember this session. All right. Then you lie down after eating. Okay. Between 30 to 60 minutes at least. So up to about 1 hour. So that the primary thing is to what? The primary goal is to slow gastric motility. Okay. And we have antispasmodic drugs. It's hyoscine part. I think hyoscine too is part of what? Antispasmodic, right? We have lots of other brands to it, other types. But if prescribed, it can also, spasms and motility. It's the motility that drives the food into the small intestines and cause all of these things. So sometimes, if possible, we give antispasmodic drugs and it helps to reduce the motility, gastric motility. All right. Any question? If you don't have question, I think our time is up. We'll take some 2 or 3 questions, then we'll end today's session. Then we'll continue, God willing, tomorrow. Okay. If no question, let's take our questions. Okay, Francis, you can ask a question.
Okay, please. I'm a little bit confused here with the third point, or is it the fourth point? You said avoid fluid with meals, and then when you come to the pepper, you said it delays stomach empty. I don't know whether I don't understand it well. And then also
avoid fluid. with meals. Okay.
Oh,
If you do that, it will delay stomach emptying. You get it? When you avoid fluids with meals, I explained that fluid with meals is like when you are eating and you are drinking at the same time. When you avoid it,
okay.
it will delay stomach emptying. Do you
Oh,
understand
okay,
it?
okay.
Uh-huh.
Yeah, the English beat me here.
Uh-huh. It's
And
the
then
English
please,
sometimes.
please, and then the second to last point, he said add fiber or protein to food, and he said
Yes, yes. So the idea, let me explain this one. The idea of this is the complex sugar I talked about,
it
or the complex
he
carbohydrates.
said it delay get constipation. They said
It slows absorption. So slowing absorption and delays gastric emptying, they are in line.
yes.
So it's the same thing. You see, fiber is a complex carbohydrate. Okay. So it takes a time to break the carbohydrate down small, small, so that you don't have everything rushing into the intestines. You get it? Francis, are you here? Oh, you're not okay.
Yes, sir. Uh-huh. Yes, sir. Uh-huh. Please come again.
So I was saying that fiber is a complex carbohydrate. So
Okay.
it breaks down gradually. Okay, so you don't have absorption going faster. Okay, you have it
Okay.
slowing. Yeah, you understand it.
Okay.
Uh-huh.
Okay. Thank you very much.
You're welcome
Yeah.
very much.
Yeah, my
Uh-huh.
hand is up.
Oh, Mr. John, let's go.
Yeah. Lying down after eating. So that you said 30 to 60 minutes. Do you lie down immediately after eating for 30 to
Yes,
60 minutes?
yes, because of your condition. If you want
Okay.
to sit upright small before, okay, so we see Nclex can be very funny. They can trick you. Okay,
Hey.
this person, what is happening is different from every other person. Sometimes even when they are eating, they have to even be at a position around 30 degrees or maybe even flat. Okay.
Mm.
Yes, because when you are upright eating, anything that goes in there, before you even finish, let's say if you're a slow eater, before you even finish eating, everything would have poured into your small intestine before you even come and sit. Before you even come
Mm.
and lie.
Mhm.
Okay. Yes. So because of that too, that's why we don't feed them plenty. Okay, to
Mm.
prevent aspirations and all of that, we take good care of. So let's say if the person is being admitted, let's say the person has NG tube, we've done gastrectomy and the person has NG tube, we don't feed the person plenty, and we don't elevate the head of the bed as much.
Mhm.
Okay, we can feed the person maybe 20 meals, maybe every 30 minutes or every 1 hour.
Mhm.
An adult, yes, depending on the recommendation that the dietitian and the healthcare provider will give.
Okay. Okay.
All right. Any other
Okay.
question?
Thank you. Please, is there a difference between cobalamin and cyanocobalamin?
This one
I know
uh-huh.
cyanocobalamin, so I was like,
This one someone should find out and tell us. Someone should educate all of us right now.
There's
Okay.
also methylcobalamin. So
Yeah, so we have types here. So
yeah.
you see, as we are doing this question, someone should find out for us. Okay. My battery is falling. I want us to finish this before it goes. Karim, next Karim, please you
Yeah,
can let
boss.
us hear
Yeah,
you. Yeah.
yeah. So I just want to correct something. So the B12 is actually cyanocobalamin.
Uh-huh. You said what? Come again.
Cyanocobalamin.
Uh, that is B12.
Yes, please.
Oh, okay. Okay. And then
that's what I knew, so I was a
okay,
bit
that's cyanocobalamin. What about the
confused.
other types of cobalamin?
Okay, so I believe there are like four forms of cobalamin.
And are they all vitamin B12 or they are different vitamins?
Cyanocobalamin is a synthetic form of vitamin B12.
Okay. Okay. All right. Thank you. So if someone has an idea of the rest too, the person can share it with us.
Okay, thank you.
You are welcome. So my first question here, I need a reader to help us read. Let us test
A nurse,
ourselves on dumping syndrome. Carry on.
a nurse teaching, a nurse is teaching a client who recently had a partial gastrectomy about preventing damping syndrome. Which statement by the client indicates a need for further teaching?
So need for
1.
further teaching. We are looking for bad answers, right? Let's
Yeah.
go.
1. I will eat small frequent meals throughout the day. 2. I will lie down for about 30 minutes after eating. 3. I will drink plenty of fluids with each meal to help with digestion. 4. I will avoid eating foods high in sugar like sweets and juices. I'll,
3.
I'll take I'll take 3.
Sorry. Do we all agree?
Yes.
Yes.
So you see,
Yes.
even with the wrong answers, they will garnish it for you. Okay, they are serving you continental dish. I will drink plenty of fluids with each meal. Look at the ending to help with digestion. So if let's say you don't know what it's about, you might think maybe to help with digestion is, after all, we want digestion to take place. So it's like the last part is let's say appealing, but the beginning part is not. So that is correct, and that's the rationale. Okay. Let's take our next question. A reader. This one, it is very, very easy. I wanted to bring case study questions on them, but case study questions, I will have to get a Q bank itself. I can't put it into a slide and share. Yes, a reader.
Okay, I read. A 52-year-old client is 3 weeks postoperative after a partial gastrostomy for peptic ulcer disease. The nurse notes that 20 minutes after lunch, the client experiences dizziness, palpitations, diaphoresis, and diarrhea. Vital signs show BP 9258, heart rate 122. Which laboratory value is the nurse most concerned about at this time?
Okay. So per someone's request, can you read the options for us?
Um, the potassium is 3.0, the sodium is 145, glucose 220, and calcium 9.5.
So with this one, even if you don't know what is being talked about, you know what is abnormal here, right?
Yeah.
Don't we?
Yeah.
So in
Yeah.
this case, what was the answer?
Number 1, potassium.
Hey, people are not confident.
Potassium. The serum potassium.
Serum
Self
potassium. Yes,
yeah.
of course. What's the normal potassium level?
3.5.
3.5 to 5.
3.5 to
3.5 to
5.
5.0.
Yes, to 5.0. Yeah. Sodium is what?
3.5
135
to
to
5.0.
sodium.
145.
Sodium is 135 to 145, right?
Yes.
Right.
And the glucose level too. So this one, you see on the Nclex, you'll be given the millimole per liter too. Okay. You are
Mm.
both giving milligram per
Glucose.
deciliter and millimole per liter. So whichever that you are conversant with. But I think to get this one in millimole per liter, you have to divide by 18. You will get it, the same thing. But you don't have to stress yourself on the Nclex. It will be given to you. Then serum calcium
Mm.
levels. What's the range?
8.5 to 10.
9.
What's the range? 8.5 to 10.
8.6
8.5 to
to 10.2.
10.5.
Yes, so some also extend it like that. So when they want to ask you questions of either hypocalcemia or hypercalcemia, they will go extreme high, okay? They will not give you within the this. So the answer is true. Okay, let's pick maybe our last question. A reader. Our last question so that we close for the day. Who is reading for us?
A nurse is caring for a client 2 weeks after a ROX NY gastric bypass. The client reports dizziness,
Okay, I'm
palpitation,
reading.
diaphoresis, and cramping diarrhea 15 minutes after breakfast. Sorry, I can hardly see.
You can't see the screen.
The writings I'm coming. Sorry. Okay, so let me take it again.
Okay.
A nurse is caring for a client 2 weeks after a ROX NY gastric bypass. The client reports dizziness, palpitation, diaphoresis, and cramping diarrhea 15 minutes after breakfast. Which intervention should the nurse implement to prevent worsening symptoms and correct electrolyte imbalance? Select all that applies. 1. Encourage the client to lie down after meals. 2. Offer fluids during meals to dilute food. 3. Monitor potassium and sodium levels. 4. Administer
Octreotide.
octreotide.
Octreotide, yeah.
Okay, octreotide as prescribed. 5. Provide high carbohydrate snacks between meals. 6. Educate to avoid sugary foods and milk products.
Some of us don't know what the octreotide is. So
Don't worry, we get to know today. And mind you, everybody is going to meet one kind of unfamiliar drug on the Nclex. But all is well, you'll still get it. Okay. So let us choose together. The first one, what do we say?
number 1.
Is it correct?
Yes.
No. Yes,
Yes.
yes, sorry.
Yes.
Number 1 is correct.
One is
Yes.
correct.
Number two,
Wrong.
No.
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 number three,
Yes.
Correct.
Yes.
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 number four.
Yes.
Yes.
Some are
We
saying
don't
no.
know.
Yes.
Number 4, no.
So I think
No.
this is
Sure.
I think
Okay.
it's an antispasmodic drug.
Yes.
Okay.
Yes.
Okay.
Yes.
Okay.
Then
Yes,
yes.
it's one kind of antispasmodic drug. Yeah. So
Okay,
you
then
can give.
yes.
What about this one?
No.
Hmm.
No.
No.
No. No.
Yes or
Yes.
no?
No, no.
No. Low
Yes.
carb.
No.
High carb, no.
Mm-hmm.
Yes.
This
Yes.
one.
Yes.
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 High.
So you see the milk product too.
Please, the high carbohydrates, I'll say yes.
You
Isn't it
say yes. Okay. So we have yes and no.
complex carbohydrates? Don't they mean complex carbohydrates?
No, the last
Complex
one
is
is
not
yes.
the same as high.
It's it,
The food should be low in carbohydrates. It should be low.
Low in carbohydrate, high in protein.
Yes, and then high in protein.
okay.
Okay. Okay. I get it
That's our
now.
answers.
Correct. Number 6 is correct.
So why why were you choosing sorry, why did you choose this one to be wrong?
We chose
Because
it
Please.
to
of
be
the
correct. You
sugary
marked it
food.
wrong.
Okay, then maybe my
We
handwriting.
chose it
Sorry.
correct. You marked it wrong. Yeah.
All right. I agree. Okay, so our answers
Please, the
are,
number one too.
please look at the answers again. Our
1,
answers are 1, 3,
3,
4, 6.
4, 6.
You see, 1,
Okay.
3, 4, and the last one 6. Option 5
Yeah, we
is wrong.
got it.
Yeah.
Okay.
Please, the
So
number
low carb.
one.
Okay, high protein, low carb. The one was asked a question. If it's fiber or complex carbohydrates, they'll let you know.
Okay.
All right. Someone is saying number 1.
Yes, please. It's like that encourage the client to lie down after meal. But in the note, it's like they give a specified time. But in this question, they didn't give a specified time.
Yes.
So I want you
So
to
At the
elaborate
end
on
of
it
the
for
day,
us.
he's lying down.
At the end of
yeah.
the day, it's lying down, whether he gave time or not. But
There
if
is
they
a
now
lying
gave for
down.
2 hours,
so
that's when there is a problem. But
so
they didn't
so
put a specific. But if they gave like 2 hours, then we now know it's wrong.
so you've even had lots of people answering you. Yeah, so I mean, at the end of the day, the person gets to lie down. Okay. If they want it to be wrong, they can say something like encourage patient to lie down after 1 hour. Okay. So when you see those things, it means like they are trying to garnish a wrong answer because you don't lie down after 1 hour. Okay. You lie down right after eating for 30 minutes to 1 hour, not after 1 hour that you start lying down. So always pay attention to the words that they use in questions. Otherwise, you'll be tricked. Okay. And
Okay, sir.
don't let anything trick you. All right. So when we come tomorrow, God willing, we shall do this. And you see, this is also like a twin topic I normally treat. SIDH and what's the opposite of it?
Yeah.
Diabetes insipidus.
Yeah, so we're going to talk
Diabetes.
about it in a bit. Then I don't know. I'm looking for, okay, so let me put this one across. If you think you're finding a certain topic difficult to understand, secretly chat me maybe from now up to tomorrow before we meet. Maybe I can prepare something and present. Of course, the topics are plenty. I didn't know which one to bring to you today. So thank you all for
Kindly show me the answers for the
for
last
coming.
question, please.
Come again.
Kindly the answers for the last question, please. There's something I want to see.
Let me share again. Let me see.
Yes, kindly.
View it for your last. For the
The last
Egyptians you see today,
No more.
you shall see no more. Are you okay?
Amen.
yes, thank you.
Okay. So the little I want to tell you is that keep on keeping on. The dream is achievable. Okay. God will help us all, and at the right time, we shall share our stories. Okay. No matter how difficult you think this thing is for you, remember, someone has a situation which is even worse. If there's any word like worse. Okay. So God bless us and keep us safe until we meet again, same time tomorrow. Have a good evening, have a good afternoon, have a good morning, depending on where you are. Bye-bye.
Hello,
Thank
sir.
you
Bye.
Please
so
don't
much.
go.
Thank
Sir, please
you.
Okay,
don't
okay,
go.
okay. Someone has something to say.